The Accelerated National Innovation Adoption Pathway, or ANIA for short, focuses on assessing whether local innovations that have worked well in NHS Scotland can have a positive impact on a national basis. Led by the Centre for Sustainable Delivery, ANIA brings together skills and capabilities from across Scotland to assess the evidence base and the potential benefits of scaling up local innovations. ANIA works with all Scottish health boards to ensure any new processes will meet patient and service needs regardless of geographical location or patient population. ANIA is considering whether artificial intelligence should be used to flag high-risk features on chest x-rays to help prioritise patients and ensure they move through the diagnostic pathway as quickly as possible. ANIA is working closely with NHS Greater Glasgow and Clyde and NHS Grampian, where such technology is already being used.
We've been running a pilot project in NHS Grampian for just coming up about 18 months now. So the project is using an AI software system, which is used to look at chest radiograph images and will flag and triage if there's an image that looks like there's a high suspicion of cancer or if there's an urgent pathology that needs to be reviewed. That's really then helping us to curtail the front end of the pathway for those patients that are waiting on diagnostics by getting their report done as quickly as possible and helping us to initiate the next step of the pathway, which is usually a CT scan, and aim to get that done within about a week or so. Before we used the AI product, that part of the pathway could sometimes take about 3 to 4 weeks, just between the acquisition of getting scans done, reporting, arranging the next steps and appointments for patients. So seeing really positive improvements on the pathway so far. We've had some really positive staff feedback so far. They've really enjoyed using the product. It's really there to help as a decision-making aid. It's not there to be a diagnostic tool, but by helping that decision-making process, they're able to navigate their workload and make sure that the most urgent work is getting to the top, which really helps to streamline their processes and streamline the pathways for the onward care for patients and ultimately get the patient to the right place at the right time.
Artificial intelligence is a tool which can make chest X-ray review process more efficient, but it does not replace the role of a doctor or radiologist. All chest X-rays will still be reviewed by a medical professional. It could take up to 7 days for a chest X-ray to be reviewed prior to introduction of this technology, but with artificial intelligence, this wait can be reduced to only a few hours. Last week, we had a patient who presented to their GP with a cough and other concerning features. The GP arranged for the patient to have a chest X-ray, which was carried out the same day. By using artificial intelligence, the case was found to be abnormal and prioritised to the local radiologist for urgent report. The radiologist agreed with the artificial intelligence, and the patient was recalled the next day for an urgent CT scan of their chest. In this case, the patient's journey was significantly shortened compared to before implementation of the artificial intelligence-enabled pathway.
Lung cancer is the most common cause of cancer death in Scotland. Approximately 5,500 patients are diagnosed with lung cancer each year in Scotland. Approximately half of those are diagnosed with cancer at its latest stage. The earlier cancer is diagnosed, the more treatable it is. It is therefore important that patients with high risk are identified as quickly as possible and move through the diagnostic pathway quickly. Approximately 6 in 10 patients will survive lung cancer for 5 or more years if the cancer is diagnosed at its earliest stage. This falls significantly to just 1 in 10 patients surviving for 5 or more years if the lung cancer is diagnosed at its latest stage. It has also been found that some lung cancers have a tumour doubling time of as little as 25 days. Therefore, each day really does count. Detecting and treating lung cancer as early as possible is key to improving long-term patient outcomes and will in turn support the delivery of Scotland's new earlier cancer diagnosis vision, which is to reduce later stage diagnoses by 18% over the next 10 years.